guest back in studio. It's Dr. Stephen Mulholland. He's Canada's top cosmetic plastic surgeon. The clinic is Spa Medica. He is also one of the stars, may I say that, of Real Housewives of Toronto?
Well, I'm really just a real house husband.
Yes, you are.
Toronto.
Yes,
but
you are.
That was a very fun season.
I'm going to say out of all, and I watched every episode because I knew you were going to be on and your wife Anne was going to be on. It turns out I also don't know her well, but I used to work with Joan Kelly. So I knew a few people and it was very interesting to me. You were very prominently featured.
Yeah, it's interesting. Most husbands in the various franchises around North America aren't, because it's Real Housewives.
Mm-hmm.
I think because of what I do impacts upon women who want to look their best and be projecting their best. It was a natural fit. So I guess because most of my life is working with women who are housewives part of the time, and want to look their best and project their best. It was interesting to be part of this series. We filmed all summer. It was like hours and hours and hours. And I just forgot about it for 7-8 months. Then it aired. So watching it for the first time was just like watching it anew, because there's about 1 million hours of tape and 44 minutes times 10.
Were there any things that came up on the show that you actually had just forgotten about?
Well, remember, it is a true reality show. There's no scripting. They just throw you into these scenes, the women particularly, and tell you, here's, you're having lunch, you don't know who with, and just let it roll. And so there's no really scripting. And the moment you've said it, you forgot you said it.
Mm-hmm.
And so, and they always seem to edit the worst thing you could possibly say and put it in there in the worst possible light, at least for me. But, I was a relatively small part compared to what the women devoted to the show. And they were 8 hours a day for literally 3 months. And so it's like a full-time job. There were a crew of 40 people that were on that show. It's the most watched reality show in the history of Canada, about 2.5 million viewers an episode.
Wow.
Yeah.
Now, when do you find out, or do you know already, will it be renewed for another season?
Well, you never know with these organizations like Bell and Rogers and Chorus, when they tend to want to buy American content, and CanCom rules have gone down, as you know, to like some crazy number, 5%. But I think Chorus stopped Big Brother, stopped funding that, and that had been 5 years, and it was Canadian content. So that's a pretty good indication. I do believe they would announce next couple of weeks that there'll be a second season.
Oh, interesting.
Mm-hmm.
And
yeah.
will you? So when you played,
part of me was really hoping there wasn't, because it's a big
you've had
commitment.
enough, and your wife is now way more famous than you are.
It's crazy, yeah. So 25 years I've been doing television, and they, you're Dr. Mulholland's wife, and now we go anywhere we go, should be mobbed by principally millennials who have no compunction about interrupting you at dinner and want cell phone photos.
Wow.
And I learned very quickly after 2 times they didn't want me in it. So I just grabbed their phone, would you like a photo? And so yeah.
You're the photographer.
I'm now the husband of Ann Kaplan.
Wow, that's kind of fun, I bet.
It is fun. I don't mind it at all, because I just hide behind a mask and a scalpel.
Well, and that's the other thing too, especially the last time you were in and Anne was here, and we got some phone calls. It's amazing how many young women really embraced and followed this show.
I think, it depends. You can look at Housewives as being silly and sort of frivolous, but it actually, in Anne's case, she's an MBA, PhD, has built $1 billion company, finds time to be a mother to 8 children, and just has fun with the show. And so there are some role models that you might aspire to, perhaps some you wouldn't. But I think, the fashion, the restaurants, the familiar Toronto locations, they did a really good job of just making Toronto look really cool. Mm-hmm. Like I watched that, and I'm not even from the city. I think, wow, this is cooler than I remember.
Yeah, they really did make the city look great. You're right. And in terms of the women who were on the show, I think some ended up looking better than others. And I think your wife is at the top of the list of the people. I mean, just because of the personality and because of everything that everyone brought to the show.
Well, I'm biased, of course, 15 years of experiencing them, but she is very, very bright, very nice, very kind, never says anything bad about anybody. So I thought she'd get completely eviscerated on a show like that.
Oh, that's interesting, yeah.
But she just held her own in niceness, which was weird. A kind of a Canadian Housewives,
Yeah.
Nothing was mean in the front. There was no wine in the face or, everyone got stabbed in the back, and it was always behind the scenes, very Canadian.
But she came across, no, and I can see that you would think that, but she's got this sort of like, this quiet strength about her. That really came across. Like no one was going to push her around, even though she never has a bad word to say about anybody.
No, she runs a very large company with over 60 employees and runs it all on her own and owns it all. So she's obviously used to managing human resources and personalities, let alone the 8 kids. So I think people tend to underestimate her because she's very nice, but she's very, very tough.
All right, we're supposed to be talking about cosmetic surgery, but this is fun. You're here for an hour, so we've got lots of time. 416-872-1010. Text us at 71010. If you have any questions, if you've been curious about certain procedures, and there are a lot of things that people are doing now that are much less invasive with much less recovery time, much less downtime. We sent you a number of things to look over so we can see where you want to start, Dr. Mulholland. But the one thing I did tell the audience just a few minutes ago that I wanted to ask you, is there any procedure you've ever been asked to do that you refused to do?
Wow, that's a great question. It's far more common to have common procedures requested by people that aren't good candidates. So someone may come in for a routine procedure, but they have contraindications to undergoing surgery. They're in the course of a bereavement. They've lost a spouse. They've lost a marriage. They are psychologically unwell. They're depressed. They have personality disorder. They are unrealistic. Their expectations exceed what can be achieved. Or they're just like crazy, wacko. And so you need to, as a surgeon, in 5 minutes, rule out what would be not good for that patient. And so it's far more common to have a reasonable procedure, but not the right patient. And then you've got occasionally a patient with completely the wrong procedure. Yeah, so I've had a couple of times a patient has come in and, wanted their nose in a certain position on their face, which would be completely bizarre, or outrageously large lips and just, crazy large implants and tiny little figures. And so just because we can actually put the nose on your forehead doesn't mean it should be there.
Right. Yes. And there are some things you will actually say no to.
Absolutely.
Okay. We're going to talk more about that. And if you have any questions for Dr. Mulholland, again, you can call in anonymously, not to worry if you don't want anyone to know who's calling. But if you have any questions, and it can be as simple as things that are less invasive like Botox or the laser stuff they do on the skin, or maybe you have a question about surgery and costs and recovery time. Welcome back to the show. Great to have you along. And in studio, our special guest, Dr. Stephen Mulholland, top cosmetic plastic surgeon in Canada. He's with Spa Medica. I was saying earlier, and I knew this before you went on the show because we've talked about it, but one of the things that was featured on the show is you going to Barcelona. And you teach all over the world. I
do, yeah. I up to 40 weekends a year. I work with different industry vendor partners, laser companies, Botox companies, filler companies, and demonstrate new minimally invasive techniques all over the U.S. and all over the world. So one of the episodes did feature all the women going to Barcelona and then getting treated with a non-surgical liposuction device, a new one called Sculpture, which uses heat. And it was a very popular segment within the 10 episodes because non-invasive fat melting is very, very popular. If you speak to 90% of women over 25 or 30 will identify an inch or two, no matter how much they diet and exercise, that if they could kill it with no risk, no downtime, relatively quickly, very little discomfort, of course they'd be interested in talking and maybe even pursuing it.
Is it that simple? It melts it away?
Yeah. Okay.
Does it?
It does. It does. It's a relatively simple procedure. There's 4 different devices. One uses cooling, and that's Cool Sculpt. One uses heating, that's Sculpture. That's what we did on Real Housewives. One uses ultrasound, that's called UltraShape, and one uses electricity, electroporation, that's called Body Effects. Those are the 4 ones with scientifically proven ways to kill fat, and they all work quite well. You need a series of treatments, 2, 3, or 4. It takes about 6 weeks to see the results you want to see.
Oh, okay. It doesn't happen immediately.
No, not immediately for sure. And generally, even at 6 weeks, you may need another treatment. So it's about, if you have a wedding coming up, it's not something you do the week before. It's not like Botox. It's something you plan like some months before, 3 months before.
And where does it go?
Well, that's a common question, and people are worried, would it create heart disease or a stroke? What happens to the fat? Number one, it's a very small amount of fat. 200 to 300 cc's. Now, how much is that? Imagine a measuring cup of fat in the kitchen. A measuring cup is 250 cc's. And that's killed and then dissipated and managed by your body's processing systems over 6 weeks. So your body can more than manage it. For instance, if you lost 20 pounds over 6 weeks, that's a huge amount of fat, and your body can more than manage that. This is a small amount of fat that's killed in a short period of time, and your body's liver and kidney has detoxification techniques. It does not affect you negatively.
416-872-1010. Text us at 71010. If you have any questions about any type of cosmetic procedure, Dr. Stephen Mulholland is here from Spa Medica taking your calls. We're going to start with Sue. Hi, Sue. Welcome to the show.
Hi, good evening.
Hi, go ahead with your question.
Thank you.
Oh, you have your headphones on, yeah. Sorry, go ahead.
I was just wondering, Dr. Mulholland, about the possibility of removing bags under the eyes and the laugh lines between the nose and the mouth without actually having surgery, without cutting.
Well, that's a very common. How young are you, Sue?
Young?
How young
Yes,
are
how
you?
young
Yes,
are you?
that's our question.
Got to think positively.
66.
66. Okay, so lower lid bags is a very common fifth and sixth decade concern. It kind of makes you look tired even if you've had a good sleep. And then smile lines are generally quite normal when you're young, but when they get very, very deep and look kind of frumpy, most women and some men don't like them. And so we do have some non-surgical techniques for the under eye bag. We can often, there's a groove under the bag, and we can put a little bit of soft tissue filler, a Juvederm or Restylane, to camouflage the bag. Now, it's not a permanent solution, but it hides the bag. So it sort of fills up the valley rather than takes the hill down. Of course, you could do a lower lid blepharoplasty under local anesthesia. It takes about an hour and remove the hill totally, quite simply with about a week of downtime, and that's minimally invasive. For laugh lines, generally either pull them, and that would be a lift of some type, suture, suspension, thread lifting, or really a cut and lifting, or fill the laugh lines with stuff you don't like, let's say your own fat stolen from your hips, and then stealthily deposit it in your smile lines, and that's called fat grafting. And you can have off-the-shelf fillers like Juvederm or Restylane that might last up to a year. So most centers would give you lots of options, non-invasive and invasive, to deal with these, and I think you should be 66, going on 50 then forever.
Still there, Sue? Is that? Do you have it? You have another question?
I would just like to know the approximate cost of each of these.
So you mentioned
procedures.
a bunch of different things.
I would just say, across the country, lower lid bleph surgery is between $4,000 and $6,000. Non-surgical treatments for the lower lid will be about half that. And then for smile lines, if you do a lift, anywhere in this country between $6,000 and $12,000, and fillers would be about half that.
And I guess fillers for people who don't want to undergo surgery, but then they have to keep being redone.
Yeah. And so over time, surgery becomes your most economical option, but of course it comes with some fear, risk, and recovery. And fillers can be just used to fill grooves. They don't create a crazy filler face. Or they can use to shape the face, and there's two different ways to use fillers. And usually smile lines are a simple way of using fillers to manage a line or a groove.
Do you have an upper age of people? Because when people get into closer to 70 and that, then I start thinking about, it's got to be riskier to operate on people.
Much of what we can do now, we can do under local anesthesia, especially facial surgery, whether it's a blepharoplasty, lid surgery, facelift surgery, minor procedures like heating techniques on the face can all be done under local anesthesia. So as long as you're in your 70s, 80s, and the oldest person I've done a facelift on was 88.
Wow.
But she was metabolically and physiologically much younger than 88-year-olds of the last millennium because we've looked after ourselves. We can manage hypertension. We know how to manage heart disease. So for older patients, I send them to an internist. They get screened. We do heart and blood tests. They're often done under local with a little light sedation, but not asleep. sleep, and I'll have an anesthetist there, even though they aren't really doing much, just in case something were to go wrong. So the risk a little higher than a 50-year-old getting, let's say, a facelift or a blepharoplasty. Probably a little bit, but it's still pretty darn safe. Remember, it's just skin and it's just local anesthesia.
And the local, I guess, is the key.
Right.
416-872-1010. Text us at 71010. Dr. Stephen Mulholland is here taking your cosmetic surgery calls. Hi, Mandy.
Hi there. How are you?
Good, thank you. Go ahead with your question.
Hi, doctor. I think I broke my nose when I was 13. I can't breathe out of the right nostril very well. I'm almost 40 now. I was just wondering, is it ever too late to get that fixed or no?
It is never too late to look your best. And if you've got a functional obstruction, which it sounds like you do, it's never too late to improve the function of your nose. So it sounds like you had a bit of a crack and the bone shifted and the internal partition called the septum may have shifted as well. And so I did plastic surgery and ear, nose, throat specialty training. So I do a lot of noses. And it's not uncommon for a woman to come in her 40s and 50s, lived her whole life with a nose she doesn't like, and finally wants to do it. And you go, well, why didn't you do it 40 years ago? Well, there's many reasons. Economic, maturity, fear, or you had a nose that was slightly strong for your face, but you had nice, full cheeks of youth. And as you age and deflate, you come in and you say, my nose is growing. Well, it isn't. Your face is shrinking and your nose just looks bigger. And so, or the last reason, you get divorced and you're back on Tinder. And so these are some of the more common motivating reasons. But so I'm just kidding, of course, but not really.
No, you're not.
if it has bugged you forever, you can fix it, and so can the breathing be fixed. And most guys who do a lot of nose surgery will have a 3D imaging program, so you can come in, take a photo of your nose, and you'll get walked step by step. Here's the bridge coming down. Here's the nose straightening. Here's what the tip looks like. So it's sort of a try before you buy, so there's no waking up with that scoop nose that you dreaded in the 1970s.
That's great, because when we come back, I'm going to ask you about it. We've got some people on hold, but I want to ask you whether or not it's automatic for people to regret as soon as they see their new nose or their new face or whatever. Dr. Stephen Mulholland is here from Spa Medica. We are taking your calls at 416-872-1010. Text us at 71010. Anything you need to know about cosmetic surgery, whether it's or the non-invasive procedures. It's all coming up on In-Depth Radio, Newstalk 1010. Welcome back to the show. Great to have you along and great to have Dr. Stephen Mulholland here in studio, Canada's top cosmetic plastic surgeon. The clinic is Spa Medica. You have also seen him on The Real Housewives of Toronto. His wife, Anne Kaplan Mulholland, one of the stars of that show. We do have a lot of people who want to talk to you, Dr. Mulholland, but I mentioned before we went to break, we'll just do it quickly. The question about, do people usually have regrets or second thoughts after they've had something like a nose job?
They certainly can, and that's one of the risks, is not managing expectations. And so we have such really good high-tech computer imaging software now where we can take your pre-op photo of a nose, and I can walk a patient through, here's the bump coming down, here's what the tip looks like. Oh, we do need to do the tip. Where they came in just wanting to do the bump, then we adjust the tip. Now the tip and the bridge look good, but look at your nostrils. They need to be adjusted. And so it helps patients understand why they need to do certain things and then look at the final result, the simulation, and adjudicate and say, you know what? I would rather keep my nose as it is. And that's the whole goal of computer imaging, to unlock the realization of what things will look like, whether it's breast augmentation in 3 dimensions or a nose. Those are the two most common things that require computer imaging. So I would say that there's the risk that patients hate what they look like after, but it's because the surgeon didn't take the time to educate them.
Yeah, and it's a good point you make that if you want to remove a bump on your nose, it changes the whole profile of the nose. So there might be some other things you can suggest so that they will be happy in the end.
Yeah, and so that's a classic scenario. They come in and they want to get that bump off, and they think that's the only thing that's bugged them because it's bugged them for 20 years. But they don't realize what the nose will look like or the face in proportion to the remaining tip and nostrils. But yet I do, because I've been doing it for 22 years. So then you show them, and then the light comes on. They say, you're right. I do need to modify the tip and the nostrils. I prefer to have that nose.
416-872-1010. Text us at 71010. Rose is next. Hi, Rose. Welcome to the show.
Yes, thank you. Good evening. I'm actually thinking to get Botox done. I've got sort of like frown lines in between my eyes starting, And I heard, though, that possibly you could not you, I'm just saying generally it could happen accidentally that when a doctor does inject Botox in that area, that your optic nerves can freeze and you might go cross-eyed for 6 months.
Rose,
Is that true?
how old are you, Rose?
Oh, I'm in my 50s.
Okay, so we're the same age, and your grandmother probably told you that, but I think that was masturbation. But I'm just kidding, of course.
I'm glad to hear that.
Botox is perfect for what you're describing, which are the frown lines or the number 11s. And you're absolutely right. Botox takes 3 hours after the injection to work its way down to the muscle. And in that 3 hours, you got to be very careful you're not rubbing, coughing, straining, or working out, because it can drift. And if it drifts off course, it can go onto muscles you don't want it to weaken. Of course, some of the muscles that you wouldn't want to weaken would be the muscles that move your eyeball, not your optic nerve. That's at the back of your eye that carries the visual image. But you can get double vision. You can get a droopy lid. Very, very rare. Happens to the best of physicians, because it's not the physician, it's the patient isn't compliant. And so Botox is awesome. Go to a very experienced center and just follow the instructions as you should with any medical treatment, and you should be fine.
416-872-1010. Text us at 71010. Sarah is next. Hi, Sarah.
Hi.
Hi, go ahead with your...
Mulholland.
Hi, Sarah.
I had a threading facelift done by you. I think it was in about 2004.
Wow, we were both just coming out of elementary school. That's amazing.
Actually, I think I was a model of yours in Florida.
Oh, wonderful. And that was 2004, so that was like 13, 14 years ago.
Yeah, a long time.
Yeah, and did you do well?
Yes, I went back to you after that and had a mini facelift done where I was kind of sagging in places.
And so
But I often wondered what became of the threads that were in my head.
That's a great...
the threads in her head.
The threads in your head. That's a great question because, thread lifts have had a real resurgence because we've now come up with bioabsorbable threads, sutures that can lift. They stay there for 6 weeks while you're healing, making the collagen, and then they go away, which is perfect. And so it's never as good as a facelift. And the mini facelift you did probably fixed up the jowly area that the threads didn't quite get what you wanted, or the threads worked for a few years, which is what they're designed to do, and then you move to a mini facelift. Now, my practice, I would have taken those threads out. So as I lifted your skin out, I would have removed the threads. The ones that we used back in 2004 were a nylon, like a fishing line, polypropylene, and they would last. So I would have taken them out. So your face is not full of threads. You are thread-free and hopefully threadless, and still no strings attached, in other words. But hopefully you're looking still great, Sarah, and at least 10 years younger than your chronological age.
So I'm curious to know, because I think many, many years ago on a soap opera, it was a big to-do because one of the characters had something like that done on the air. So if the thread comes out, so the threading is essentially pulling back the skin with threads. But if the thread comes out, what's holding the skin back?
So the threads have little devices all along them, call them little barbs or tiny little bioabsorbable cones.
Like hooks.
Yeah, little hooks. And so the hooks are going in the direction of the lift. And so you have two isolated threads. You pass them expertly through the soft tissue. You pull, just think of your finger and your thumb on your cheek as you're lifting, simulating a facelift, the same thing.
Oh, it catches.
It catches, and then you tie those knots down up into the hairline, and it keeps your face lifted with these sutures. Now, the bioabsorbable ones, the one that go away, gets replaced by your own collagen. So the collagen over 6 to 10 weeks starts to hold up the lift as the thread dissipates. And so it's never as powerful as a facelift, but it's the best non-surgical lift we currently have. It takes less than an hour to do. There's no cutting. And so suture suspension, thread lifting is very, very common in my practice for those people that don't want a facelift, but they want something better than just Botox, just fillers, or just energy-based devices.
How long does it last?
I tell them 3 to 5 years, whereas a facelift is 8 to 10 years.
Before we take a break, if you're on hold, stay on hold. Dr. Mulholland is sticking around for another segment, 416-872-1010. Someone writes in, Rosanna has a question. She says, my daughter is 18 and has been wanting a nose job for the longest time. What is your opinion on the right age, and what are some considerations at that age?
Well, Anne and I have 8 kids that we've almost brought through teenage years. And certainly being a teenager is hard enough without complicating with self-image, body image, and cosmetic surgery. Yet it's also very hard when your nose is clearly way out of the craniofacial proportions that your face was meant to bear. And so there's two sides of the coin. I would say for a mature 18-year-old, and there are some very mature 18-year-olds that have carefully thought about it with parental consent involved, nose surgery can be emancipating. It can emancipate yourself from the tyranny of that nose that just was never meant to match your face. For the not quite so mature teenager, 18 is just the wrong time to do it when they have a pretty face, the nose is reasonable, but they have a whole bunch of body image issues. They need time to grow up, and sometimes they'll come back and say, I'm really glad you didn't do my nose because now I'm 22, I quite like it. And so it depends on the teenager.
It's such a great point.
And I think 18 is the earliest it should ever be done. Number one, for the first 17 years, your nose is still growing. The 18th year, it's not. And number two, your mind is still growing, and your personality is changing, and your maturity and level of confidence may not be tied to looks as you get older. But if you've got a great big nose and a tiny little face, some of my happiest patients are 18-year-old girls who finally have a nose that both their mom and them participated in choosing that now matches their face.
Sometimes, I will say, you do occasionally see people where it's obviously just too big for their face.
It truly is. And it's one of those hereditary jips. You can't hit the gym, work off the bump. You can't sort of diet and exercise your way into more facial nasal harmony.
Yeah. Okay, we're going to continue on with your calls. 416-872-1010. Text us at 71010. If you're on hold, we will get to your calls, I promise, just as soon as we return. Dr. Stephen Mulholland is here, cosmetic plastic surgeon at Spa Medica. Welcome back to the show. Great to have you along. We have Dr. Stephen Mulholland here for a few more minutes. And actually, this is something really interesting we're going to get to just before he leaves. This really amazing procedure for women as they get older that I don't think is as commonly known as some other things. We'll talk about that in a couple minutes' time. But Dr. Mulholland, we've had some people waiting very patiently to talk to you. 416-872-1010. Here is Eve. Welcome to the show. Eve, go ahead.
Hi. I wanted to know, what is the best treatment for melasma? Maybe the best and then as one, and then the cheapest as another.
What is melasma?
Eve, how old are you, Eve?
Do I have to say?
Well, how?
Late 40s.
Okay, so you're over 20. We'll say that.
Yes.
And what is your ethnicity? Are you Mediterranean?
Yes.
Okay, so melasma is a condition of excessive pigment, and it's really a curse. And every genetic subtype has a curse. Celtic, North European, Anglo-Saxons tend to get red, ruddy, rosacea faces, and Mediterranean, Asian, Southeast Indian tend to get darker brown discoloration. And melasma is a bit of a curse because it can happen just with hormonal changes. It can happen even if you avoid the sun. And so it's very tricky to treat, but it can be treated. So answer the first part of your question. The best treatment is to see a doctor that has laser medicine, particularly a picosecond laser, PicoSure, PicoWay. This is such a short pulse duration laser that it helps break out the melasma by not creating heat. Photofacial or intense pulse light creates heat and often makes the melasma worse. So you need a picosecond laser and good medical suppression skincare, retinoic acid, hydroquinone, kojic acid. Now that can be quite expensive, might $3,000-$4,000 for a program, but it should give you 50 to 70% reduction in your melasma. And you have to remember it's a chronic condition that never goes away, like diabetes of the skin or hypertension. And so you have to stay on a maintenance treatment. What's the cheapest? Stay out of the sun. Stay out of the sun, and stay out of the sun.
When you say the treatment cost, does that include the treatment plus the...
Correct.
Okay.
Yeah, it's a package of skincare and a series of picofacial treatments with a picosecond. And then and just like if you stop your insulin, your diabetes goes crazy, you can't stop your hypertensive, you got to come back once every 3 months forever and ever. It's kind of a skin curse that's manageable.
Great. Thank you.
Thank you, Eve. You know what? It's funny because that may sound like a lot to some people, but then you think about what some people spend on their hair every month and on their nails every month. And, if it's something that really bothers you and you can address it that way, I guess everybody just has to decide what point it's that difficult for them. Hi, Peter. Go ahead with your question for Dr. Mulholland.
Good evening, Barb, and thank you for taking my call.
Sure.
I had a question about lymphomas. You mentioned earlier that freezing or sculpting can take away a cup of like a fat from your body, or freeze it away, or does that work for lymphomas?
Lipoma.
I mean lipomas, because lymphomas are blood cancer. I was thinking, no.
Sorry.
But
No.
lipomas,
Yes.
yeah.
And if it doesn't, is the surgical extraction a better way of dealing with it?
Yeah, so lipomas are benign, slow-growing growths of fat cells, but they're not cancerous. But they can be cosmetically unattractive and sometimes be close to sensory nerve and be painful. And so there are techniques that you can try non-surgical fat destruction, but it generally doesn't work because these cells are very hardy. Even though they're not cancerous, they're pretty tough. And even doing liposuction on them doesn't tend to work permanently, because if you leave roots behind, of course, they grow again like a wart. And so just like a wart, you just got to do good old-fashioned maneuvering. And so a small little incision, spreading the flaps up and enucleating the entire lipoma and all the cells that if you leave behind will just grow again is still, after all these decades, the best way to do it.
All right. Thank you so much.
All right, Peter. And so I guess I was going to say, does it come back? But you're saying if you get it all, it won't.
It could, but if it's all extracted, roots and all, it's not going to come back.
Okay, we have a few minutes left, and you were telling me something in the break that I thought was fascinating. We were talking about very popular surgeries, including butt augmentation. And we've talked about vaginal, I don't know, what are you, refreshing or?
I would call it vaginal revitalization.
Revitalization. But then there's this other one that I have never really heard about, and it is for post-breast cancer women, for women in menopause. So I'll just let you take it.
Sure. You know, we always focus on, let's say from the chest up, the big five: breast augmentation, facelift, rhinoplasty, blepharoplasty. These are the most common treatments. But fast and furious, particularly amongst millennials, those up to the age of 35, would be buttock augmentation. I think largely in part to the Kardashians. This large, round, full bum, almost exorbitantly large, has become a millennial kind of fixation. We've always taken fat during liposuction, offered to re-inject in the breast or in the buttock or in the face, just in modest amounts, plump things up a bit, maybe not round it out a bit. But a very large buttock augmentation called the Brazilian butt lift, or BBL, has become very, very popular. I'm not sure it's here to stay. I'm not sure every body type looks very good with it. You could say better a J-Lo than a Way-Lo, but I'm not sure everybody needs a Kardashian. Okay. And then
all right.
When it comes to vaginal revitalization, yeah, sure, there's labial reduction, labial augmentation, and, bikini hair removal and all kinds of things that happening down there. But one of the neatest things that's been developed in the last 2 years are for postmenopausal women, or tamoxifen after breast cancer. You become menopausal immediately because it cuts off the estrogen, which is the symptoms, it's called the genital urinary symptoms of menopause, which are a symptom complex consisting of postmenopausal dryness of the vaginal canal, discharge, irritation, and incontinence, urinary incontinence. And about 80% of women over 50 have one or more of those symptoms. Of course, what are you relegated to? HRT, which increases the risk of hormone replacement therapy, increases the risk of cervical cancer, breast cancer, or suppositories, or creams, or you just live with it. We have this cool little endovaginal laser now it's inserted much smaller than a speculum. It rotates 360 degrees slowly on the way out, a centimeter a second, and it does fractional resurfacing of the canal, much like you would on your face for wrinkles. And it revitalizes the entire mucosa. So there's about an 80% reduction of symptoms with a series of 3 treatments, 1 month apart under topical anesthesia, and it takes literally 12 minutes for each treatment. So it's really changed the lives of many women that suffer from those symptoms. And it's not about sexuality, it's just about those 4 main symptoms that women can feel. And of course, there's vaginal laxity improvement, collateral benefits, but most women do it for the symptoms and the symptoms alone.
And you said it is relatively new. I had never heard
It's very new. There's a laser called the Mona Lisa Touch, which is the most common in North America. There's the Core Intima. These are the 2 most common devices that are used to do this treatment. And again, in Canada, there's probably a dozen centers that now offer this.
It's always great to have you here. Thank you so much.
Thank you for having me, Barbara.
All right.
It was fun.
We'll do it again soon. Dr. Stephen Mulholland, cosmetic plastic surgeon at SPA.